Vagina is self-cleansing. I mean, modimo o entse le jwalo. Ske la e hohla. O cleana ka mo ntle fela mona and then ka metsi le sesepa for that you have to clean.
This is the Dr Show. Thank you very much for being here. Welcome to the Dr. Mongezi Show, and today I bring another exciting topic of sexual health and sexual pleasure in a way that is very affirming and allowing you to experience the fullness of what your body can do, but also what pleasure can do for you. On that note, let us begin. I'm so thrilled to be joined by Dr. Mongezi Siqana, a medical doctor who specializes in obstetrics and gynecology. And today I've invited him to come and just share some insights and expertise, but also help us understand the different ways in which we can improve understanding of our own body and, of course, how to seek health better and ultimately enjoy the most pleasurable experiences that we can. And in doing so, as usual, we want to get to know the men first. So welcome, Dr. Siqana, and we're going to just break the ice a little bit, get you to settle down. And in order to do that, I'm going to ask you a few questions, right? Off the cuff. Truth or dare?
Dare.
Can I give you a dare right now?
Yes.
Can you lead us into a song, in your favorite gospel song?
All right. Jesu ki ngaka e khulu enang le matla a sa fele go thala o rapele o tla o neha phodiso.
Oh, Doc, I've known you for a long time. I haven't heard that voice. That was spectacular. Well,
Part time.
part-time, I can tell, and I love it. And then,
Thank you so much.
and knowing your time as a doctor, things are very rushed, but who knows? DIY or ready-made?
Ready-made.
Ready-made.
Yeah.
Why?
It's because I'm busy. I have to take care of my family, see patients, and make sure that they're well and healthy. So I think that works for me.
It works. Okay. And out of sight and out of mind, or distance makes the heart grow fonder?
For me, distance makes the heart grow fonder.
Blow blush. Romantic, what's my dog?
Yeah, I am.
Yeah. What's the most romantic thing you've ever done?
Hey. I
You don't want to because you like No, thanks, Doc. But also, I think what's interesting, right? We've always reached out to you a lot at DSA Clinic for support. But let's hear about your own experience in medical school. Like, how did that shape who you are now and what that experience still means for you?
So I went to the University of the Free State. So I was there from 2008 until 2012. So you arrive there, you are from high school in Velcom. I mean, people know that you are good in school. I use the laptop or computer just for DJing and stuff like that. But there you have to do assignments and boom, you don't even know how to type and where to start. So I think the first thing was discipline. How I used to do it is we would go to school, like lectures and stuff like that. And later on, I'd spend like from 10 o'clock until 2 a.m. at the library so that I can keep up and make sure that I'm disciplined and what I went there for, I knew that I would come out.
You get at the end. And here you are, specialist OBGYN. What is OBGYN?
Okay, so that's obstetrics and gynecology. So it's two things they involved. So the obstetrics part of it means that we take care of mom from pregnancy until they deliver, and then even after they deliver, we take care of them. So that's the obstetrics part of it. So it's pregnancy part of it until we deliver, taking care of mom, doing scans, make sure that they are healthy, their blood pressures are fine, they don't have diabetes until we deliver them. So and then the gynae part, we take care of women from like from puberty until menopause. They were dealing with your fibroids, make sure that your periods are fine. We screen for cancers, help with sexual health and pleasure. So that's the gynae part.
And that leads me to understand that you have a patient who, on the one consultation, may be gynecology related,
Yes.
and they can move to be an obstetric patient the very next time you see them, right? So it's a very dynamic kind of speciality, but also experiences that we have as women. How then do you assist, for example, and this is a problem that I've come to you a lot on, where you have younger women who make the choice to say, I don't want to get pregnant and I have no desire.
I think the important thing is we have to take patients as they come. People are not the same. They come from different backgrounds and whatsoever. So when patients come to me, we go through that. Like, how do you look at like family or even planning towards that? So, and then, a permanent solution. So for me, there's two things that we can do. Patients are not the same. So there's something that we call a loop. It can take up to 10 years to put it in. So, and then it helps the patient not to fall pregnant. And the failure rate of it is very low because it doesn't depend on the patient. And then the other thing, it's sterilization of patients. It means we tie off the tubes or fallopian tubes, or we remove them. And then the other thing, for the partner, we can send them for a vasectomy. So that is the permanent solution for that. Yeah.
I think it's a good point that you're making to bring in vasectomy in a discussion, because often when we talk about family planning, contraception, we think women's responsibility, right? So in your practice, how do you have these conversations then when it's perhaps a desire of a woman to say, we need to plan better, and yet the solution lies with her partner who may be a man? And so how do you bring him into that discussion?
Yeah. So I think the important thing is, it's two people that we're dealing with in that particular session that we have. So what I would do is to bring it in to say that it's not only mommy or our female patient who has to take the burden of sterilizing because you don't want to have baby. So the gentleman can come in, and then vasectomy is done. It's a procedure that is done in the rooms. It takes a few minutes to do, and it's permanent, and it's not painful, and it can be done. So in this day and age, it does not depend on only ladies. Even us as gents, if we're saying that's it, we want to close the factory, we can come in and help. Yeah.
I like that a lot. And it leads me to thinking of some of the myths, right, that surround our sexual health, but also what our bodies do and also how our bodies change. And I think vasectomy is one thing that Twitter, Majida, work vasectomy, immediately, but no, you are going to affect my performance. Those are kinds of the myths. So is it a fact or a myth that a vasectomy affects your performance?
So that it is a myth. Definitely, because when you are doing a vasectomy, the only thing that you're doing is just tying off the tube that sends the sperms into the canal of the penis into the woman.
Thank you for that, because it's a big one. And I think that's often what keeps people from getting the right kind of support. Also, in terms of social media questions, I did ask people in advance just to think and prepare some. I get asked, of course, randomly. You also get a lot of questions, but I've come up with what I think is a list that will fairly cover what people have as concerns. And so let's tackle the first one. Does lack of sex have any detrimental health effects in the long run?
The answer to that is no. Yeah. So if lack of sex does not cause any detriment in the long run, but people, what I will always say is people who are having sex regularly are people who are happy.
We're happy.
Yeah.
Are we happy at this table?
Yeah, we're happy.
Okay.
Very happy.
Okay, doc. Certified.
Sure.
And is low libido a sign of an unhealthy immune system?
No. So, and if you have that, I think the best thing would be to consult a medical practitioner and pull bloods and see what is going on with you. But it's not a sign
in itself. Another question: is it wrong to have sex during my period?
it is not wrong, but there's things that can happen there. You can still fall pregnant. It depends who you are having the sexual intercourse with. You can pick up sexually transmitted diseases. So it's not wrong, but it comes with things that you wouldn't want to have. Yeah.
So I must declare now I used to be team lay a towel. Periods must not disrupt people's pleasure. And so thanks again. And then the last one is that why am I still on menopause? It's been 2 years, doctor. Why?
Menopause means that you have not seen your periods for more than 12 months. So, and unfortunately, menopause is a permanent thing. So you're
Fortunately, doctor, please say we are suffering with hot flashes and all sorts of things.
Yeah. So fortunately, so I mean, it's a permanent thing. So if they've stopped, your periods have stopped for more than 12 months, it's permanent. So you won't see them. You shouldn't see them anymore. If you do see periods after you have stopped your periods for 12 months, it's a concern and you need to consult because we need to exclude things like cancer.
So what are some of the symptoms of perhaps even menopause, and not necessarily early menopause? And I'll give you a funny story. I've always had a dream that one day I'm gonna go lecture at Mount Sinai Medical School in New York, and dreams were coming true. And that's the day the lecture is full and I'm doing this lecture on human rights and health. And halfway through, I could feel literally my whole body dripping down with sweat. And I experienced my first hot flush, literally like that. So what are some of the symptoms that women can look out for? Because beyond just abnormal menstrual cycle, there's a lot that goes with starting the journey and the process of menopause.
Yeah. So I think the important thing is like menopause usually starts between at the age of 51 most of the time. And the symptoms that you will see, we call them vasomotor symptoms. So you will have like hot flashes there. You can have things like vaginal dryness. I mean, the vagina becomes mucosa, or the inner side of the vagina becomes thin. So you're prone to urinary tract infections, painful sex that we call dyspareunia. You lose hair, your skin becomes dry, you have forgetfulness and insomnia. So those are the most common things that you would have when you are postmenopause or look out for. And then in terms of complications, really, I think the common thing would be osteoporosis. So that's, bone mineral loss. Yeah.
And experience hot flash, literally like witnessed by 200 people, was quite intense. I mean, and I'm grateful that I knew what was happening, but it was really like embarrassing, completely not ready for. So how do you help your patients, right? Because we have different lifestyles as well, and you can't predict often some of these symptoms. So what are the kinds of conversations you would have, or advice you have for women who think they may be having menopausal symptoms, or maybe they think it's menopause and it's something else? So how would you take us through that process of getting to the actual diagnosis?
Yeah. So, I mean, if a patient comes and tells me like the same thing that you have said, so I think the important thing is to ask, was it for the first time, and actually understand what happened at that moment.
I mean, pleasure. I think I prescribe most lubricants than any other thing in my practice. That's how much I am committed to people having pleasurable sexual experiences. How has your practice shifted, right? Since you are someone who also believes in not just the medicalization of just our bodies, that indeed we do all of this because part of it is being fully human and sexual. So for me, it's about lube. What does it look like for you in your practice?
Yeah, for me, I think a lot of people, I'll say this, like especially Black people, are not comfortable firstly with their bodies. So they wouldn't want to call a vagina in their language and know their body parts. Yeah. So for me, it has been education with knowing your body, know this part of this is the meatus, this is the vagina, which is the opening. Because I mean, when you look at it, like you've got a vulva, you've got the vagina, yeah, and also know your body. Like, where is it nice? Where is your G spot? And and then
And how to find it.
And
And
how-
you can find your own G spot.
for sure. And then at least in communication, so that both of you are happy and there's no rush. Take time into knowing each other and be comfortable with each other. Yeah. So that's what I've been doing in my practice here.
And the common causes for maybe painful sex or sex that's not satisfying, right? That we can maybe share with people and maybe suggest some of the solutions to some of those common causes.
So I think the first thing would be lack of foreplay. People are in a rush just to shove it in and stuff like that. So I think we need to work on that. And then I think it starts with what makes you happy and what makes it pleasurable. So I think the pain comes most of the time with lack of foreplay. Then so and then I think the causes, or you are talking about pain. So there can be conditions that can cause that. I think we've spoken about menopause, be it the natural or premature menopause. There's conditions, I mean, especially neurological conditions that can cause vaginal dryness. I mean, drugs that you take that can cause...
normal flu medication, the same way it dries out your nose and your mouth, can very well dry out your vagina.
Does that, yeah. So I think the important thing is know what makes you happy. And what gives you the pleasure that you need. Take time to know each other, and then know where your G spot is, and your partner to know, and just communicate. This works for me for this time and that. And then in terms of medical conditions, I mean, they need to be treated. And in terms of the drugs that you take, you need to know that this one's cause this and whatsoever. So it means staying away, if possible, from drugs or taking things that would cause pain. Yeah.
I mean, one of the questions I know that I also often hear women complain about is fibroids, right? And sometimes it can be as small as a grape, right? But as big as a golf ball. So, and the kind of pain they cause also depends on where they grow.
So fibroids are like growths that happen like in the uterus of a female. So they grow from the muscular layer of it, I mean, and they're fed by the estrogen, which is one of the hormones that our women have. So, I mean, they can start from being a marble up to a rugby or soccer ball size, isn't it? In some women, you can see, some of them think they're pregnant and stuff like because of the size. Most of the time, the patient complains of heavy menstrual bleeding because of fibroids. It can cause like urinary tract infections because the fibroids, when they grow, they press on the bladder. It can cause constipation if they're pressing on the bowel side of it. So if you've got fibroid, it's something that is known, and like I said, like it's commonly in black people that they have fibroid. Most of our white patients or Caucasians don't have fibroids. And then how do we deal with them? I think just in a nutshell is to say, do you want to fall pregnant or you don't want to? If you want to fall pregnant, we can remove the fibroids. And then if you don't want to fall pregnant, the next question is, do you still want your womb to be inside your body or out? So, and then we take it from there.
So, Doc, on that spirit of questions that we have from our listeners and viewers, does a self-cleansing vagina mean that I must not wash the vulva as well?
Yeah. So no, the vulva must be washed.
So where is the vulva?
Yeah. So the vulva is the outside that you see. Okay, and so the difference is, so the vulva is what you see outside, and it has different parts. So it's where there's hair, we call that the mons pubis. When you go down a little bit, that's the labia majora, that makes a V on top.
Bigger lips.
Yeah, bigger lips. And then at the top, like at the corner up there, just underneath, you get the clitoris, which is what makes things go wild. Okay, and then lower down, labia minora is the thin lips, and then you go down, and then the vagina, it's not what you see or the outside, is there's a vaginal opening, and then vagina is this elastic tube that is inside. Okay, so yeah, that's there. So you have to clean.
to put our fingers
inside the vagina because it's self-cleansing. It has what we call pH. It has stuff that keeps it clean. Because if you're putting fingers in soap,
just tell them again.
yeah. So the vagina is self-cleansing. I mean, modimo o entse le jwalo, ske la e hohla. O cleana ka mo ntle fela mona and then ka metsi le sesepa for that you have to clean. But the inside you don't have to. It's self-cleansing.
Thank you, Doc. Another myth perhaps is that when you are having too much sex, your breasts are going to be sagging and you're going to have cellulite.
Yeah. So that's definitely a myth. That's not true. Yeah, and people shouldn't take that, yeah.
Let's shift it a little bit, right? Because we're talking about vagina and women. And Majida don't think one they have any issues with hygiene. But they're always having lots of comments about our vaginas. I want to talk about this issue of hygiene, but also let's talk specifically. How do you cleanse a penis, for example, that's uncircumcised, right? Because we know there's that excess skin. So how do we deal with that? And is it equally important to be hygienic and to pay attention?
Yeah. So how would you clean a penis that is uncircumcised? Is to pull the skin over the head of the penis and then clean it every time that you bath, so that you make sure that there's no dirt. Like most people are getting but like it looks white. Yeah. So you clean every time you bath, because when you do that, I mean, it's clean and then it stays away from infection. It increases sexual pleasure, and then also it makes you, it protects you from, or it decreases the chances of you having sexually transmitted disease. Yeah.
But the condom, of course, is still important. Doc, talking about low sperm count, what causes a low sperm count?
So, I mean, the most common thing is, I mean, lifestyle. I think, like in our day and age, we look at the age spectrum as well. So for younger people and that, it's really lifestyle. What am I talking about? It's sedentary lifestyle. So, I mean, obesity can cause it. I mean, alcohol, excessive taking of alcohol, drugs, cigarettes, marijuana. And then the other things is conditions that patients can have, be it a tumor in your brain, be it a tumor in your testes, be it a tumor in your penis, and other things like radiation. If, let's say, you've got cancer of some sort, radiation, chemotherapy, so treatment of that can cause a low sperm count. And then the other things would be infections, also can cause.
Also, Doc, I mean, to the laptop on our laps, you know, I've often heard that heat that comes from the laptop is not good for the scrotum as well.
Yeah.
And on the issue of circumcision, right, medically there may be, like you have said, some benefits, but is it like necessary to always have?
So I would say yes, because like I said, like at least you don't have to pull up and down. It's there, and the ladies like it.
The lady is doing something for us at least for once. So maybe let's think about a different set of viewers, right? Who may still be wondering about their changing bodies, about puberty, and, you know, one of the big ones is wet dreams, right? Do girls also get wet dreams? And what are wet dreams to begin with?
So I think wet dreams happen only in boys. So you wake up there, you find, like in a nutshell, wake up and then you find the sperm on the bed or on your underwear. Yeah, so but it happens in boys, especially as they reach puberty, but girls don't have wet dreams. Yeah.
And that's a normal
It's a normal thing. Yeah.
Physiological process that happens. Okay. For people who are yet to start their period, and I'm thinking about the preteen girls, what are some of the changes that they can start looking out for, right? That's going to suggest that maybe they are closer, right, to that first menstrual cycle.
So I think we call the changes that they can expect, we call it secondary sexual characteristics. So what am I talking about? You see their breasts will start budding, and then they'll start having hair, be it pubic or in the axilla. So and that's and then even the way the hair grows will show them that they're close to being there. So, and usually we are looking at age 9 and about 14. Yeah. So once you are close to that age, so you know that it's coming closer. And then obviously, I think the important thing is to, when there's parents or guardians that are there, can just teach them that what to expect. They will start bleeding, which is spotting. Most time it happens at night, and which is a normal thing. And then I think maybe just to have like sanitary towels handy when the child is close to that. Yeah.
And of course, it seems to be the trend that younger girls are having that period or that menarche earlier than maybe we did. Why is that?
So I think I think it's based on maybe the food that we eat. I think that's the most common thing that has changed like over time. So I think I'll base it to that.
The meats that we eat get injected, right?
Yes.
With other hormones to make the cattle grow, and some of that, of course, ends up in our own bloodstream. So here's an interesting question, and maybe we think it's for young people, but I think it's mainly it could apply to people who have never had sex before and are still wondering, like, is the first time painful? How do I make sure that I'm not hurting or causing any discomfort to my partner? And I think it's important, to have that discussion as well, because not everyone has access to reading or having trusted adults where they can have these open conversations. So for people who are interested in having affirming, respectful sexual experiences, what do you say to them? Especially a young man who says, well, I want to have sex, but I don't want to hurt my partner. How do I go about that?
Yeah. We would like patients to see or go for therapy, even not because they are sick or there's something wrong, just to seek, that information. So I think the important thing would be like give information to say that, when it's your first time, you can imagine that your partner has never had maybe intercourse in that case. So because nothing has penetrated it, it will most likely be painful. So the important thing is, have a discussion and then have more foreplay. Get as much lube as you can.
Lube.
And then the important thing is take time. Don't be in a rush to do it, especially if it's for the first time.
Yeah, and that's why even this idea of the first time, I always try to demystify it and not make it such a thing, because I think to get to a comfortable space, it's gonna be more than just that one first time. And I think there's different ways of gently easing yourself into things. But again, when we're just going back to the issue of menstruation and menstrual health, it's always seen as the mother will deal with it, right? But what about men? What about fathers who want to participate, and should they be participating in that process as well?
So I think you're raising an important point there. So, and I believe that all men should learn about menstruation and what to expect and what happens there. Because can you imagine you are a father, mommy is no longer there, and you've got a 9-year-old who sees blood jumps and they're scared that maybe they are sick. So I think it's important that we need to educate, like in our families, we need to educate our boys and men, and then in schools. And I think it would be a good thing if it's put out there about menstruation, what to expect, and how can you assess.
And also not separate the boy child and the girl child during life orientation, right? Everyone needs to know what's good and well. And I just want to ask you a question, because you've now gone into the very intellectual doctor mode. What gives you joy? What makes you happy?
Me as a person. Okay. So what makes me happy is to spend time with my family, my kids, my wife, and my mother and my siblings, or friends, to be around people that I mean a lot to and who show me that. So that makes it for me, as long as I have that. And lastly, obviously, I've been doing this since 2015, spending time with my patients, making sure that they're happy every time they come see me. When they leave, they're happy and they're looking forward to seeing me next. So those two things are important. mind.
And thanks for doing that for all of our patients that we send your way. And so to mark this moment, I'm going to ask you to raise your glass and make a toast to something that's meaningful for you.
So I'd like to raise this glass for love, for family, for friends, and for my family, T and Elna. And thank you so much.
The best.
Thank
Cheers.
you so much.
And on that note, thank you for being part of this conversation. I hope you walk away feeling empowered, a bit more knowledgeable to also even just get the best out of your medical consultations. But most importantly, the less fear we have about our bodies and how things change, the better for all of us. And I wish you the best pleasurable sex ever possible. I love you. Ke le rata ka love. Till next time, remember to like and subscribe and share this episode widely within your own community.